Hello everyone, my name is Peter Melamed, PhD. I am holistic practitioner of the Biotherapy Alternative Medicine Clinic in San Francisco. Today our topic will be what you have to know before and after gallbladder removal. Why is this topic is very important? By medical statistics, 750,000 operations was performed in United States annually. So we have a huge crowd of people without gallbladder. If you have a pain in the right upper part of your abdomen area, the doctor usually sends you to the surgeon. And surgeon tell you, listen, the operation will be very simple, will be without pain, cosmetically will be very accepted, and this is like ambulatory surgery. This is right. And then the surgeon can tell you that you don't need your gallbladder. Gallbladder, it's just sac who collected the bile. It's not important thing in our body, not important organ in our body. So the people can live without it. And if you have a pain, after operation it will be gone. It's not exactly correct. From 10% to 33% of people without gallbladder, anyway, they continue to have a pain in the upper right part of the abdominal area. More, by medical statistics and medical papers, 20% of people after gallbladder removal, anyway, they have some problem with pain and indigestion. It's called post-cholecystectomy syndrome. What does it mean? Cholecyst, it means gallbladder. Ectomy, it means surgically remove it. Cholecystectomy, this is means the surgery for gallbladder removal. Post, it's after, post-cholecystectomy syndrome, it means the syndrome, it means the cluster of the symptoms. So what kind of symptoms can be after gallbladder removal? I mentioned already about pain and cramps. Later it can be some gas, bloating, bile reflux, it can be constipation, it can be bile acid diarrhea, and many other things very far from gallbladder. So to talk about the symptoms and how they develop, we need to focus on very simple anatomy and functioning of this area. So let me start from analogy. Can you imagine two rivers? One of them the big, clear water. This is, can imagine like the pancreatic duct. And another river, it's a little more small in size, and they have a lot of debris, may have stones, and this is a common bile duct. So common bile duct moving the bile from gallbladder and from liver. So these two rivers, these two ducts merged with each other in this place, and this place surrounding the special muscles valve. These muscles valves have a name of the sphincter of Oddi, because the Italian anatomist Ruggero Oddi searched this anatomic valve. So this is a strategic point, and many doctors considered in this area can be developed many digestive disorders connected to the gallbladder, liver, pancreas. So how the sphincter Oddi works? They can be closed and can be open. When usually it's closed, so the food going from the stomach, they go to the first part of the small intestine. It's called duodenum. So when the food going to duodenum, they have a signal message, and in this area, in this time, the gallbladder contracted, and the sphincter of Oddi is open. When the sphincter of Oddi is open, the pancreatic juice and bile coming to the duodenum for digestion. This is very important part of functioning. If the food doesn't have it, doesn't arrive in duodenum, the sphincter of Oddi closed, and the liver manufacture bile, so the pressure going inside go up, so this is the bile redirected in the gallbladder. Gallbladder expand. This complex regulation happen by functioning of the nervous system and special blood messenger digestive enzymes. You have to understand very important thing. The mother nature doesn't make a mistake. So with gallbladder, we have gallbladder. They have some very important function. This area, this area very important. Regulate very complex regulation. The regulation is by nervous system because we have a nervous branches and surrounding the gallbladder and surrounding the sphincter of body, and they regulate close and open. And we have a blood messenger. This is a digestive hormones. These hormones go to the bloodstream and again regulate functioning of these organs. This is just first part of presentation about post-cholecystectomy syndrome, and later we will focus on different part of this syndrome, what kind of symptoms, and later we will focus what we have to do for it. Again, thank you for listening and watching. Have a good health.